Welcome to Myths Mischief, a new kind of creative coalition founded by our parent organization, Basic Studios. Our core beliefs can be summarized in one word: courage. Trigger warning: the following discusses suicide, suicidal ideation, and death. This year, our second annual Survivor Summit 2025 event is here to address mental health, personal identity, and literal survival, giving our viewers access to tools and conversations that could benefit them in a world that seems to be growing more and more chaotic and challenging to navigate. Specifically this year, we will be focusing on what it means to be neurodivergent in a world that often fails to understand or support us. Every year, about 49,316 Americans die by suicide. It is the 11th leading cause of death in the United States. The most common method of death by suicide is firearms, which account for more than half of all deaths, followed by suffocation and poisoning. Data shows that neurodivergent individuals, specifically those with autism, are more likely to struggle with suicidal thoughts and attempts. Contributing factors often include depression, social isolation, trauma, difficulty with problem solving, and barriers to accessing effective coping strategies. These struggles are not isolated to just one population either. While suicide rates vary across groups, we are seeing alarming trends in minority communities. Indigenous populations have the highest suicide rates in the nation. The Centers for Disease Control and Prevention, or simply the CDC, reported in 2022 that the rate was 27.1 per 100,000 people. The suicide rate among Black Americans has been increasing, particularly among youth. In 2021, Black high school students were 60% more likely to attempt suicide than their white peers. For LGBTQIA+ youth, the statistics are also grim. The Trevor Project's 2024 survey showed that 39% of LGBTQIA+ young people seriously considered attempting suicide in the past year, and nearly half of transgender and non-binary youth considered it. Access to care is also a significant issue. Over 25 million rural Americans live in areas without enough mental health professionals to meet demand. For example, some estimates show that up to 65% of rural counties lack a psychiatrist. The second annual Survivor Summit 2025 is a space to confront these realities together, to speak openly and candidly, and to connect people with the tools and community they deserve. We believe in building networks that are rooted in understanding, accountability, and care. That's what Myths Mischief is. We are working to create a network of trust, support, and foundational respect where we can learn from each other. At our second annual Survivor Summit 2025 event, we will connect, share our stories, and learn skills to build a better future together. We are not afraid to talk about these complex and heavy topics. This is our act of courage. Join us on September 20th at 3 p.m. Pacific Standard Time or 6 p.m. Eastern Standard Time for a live stream where we will have guests and start to have those tough conversations in a safe and low-stakes environment. Remember to save the date and subscribe to be notified when the live stream begins.